Hi, the topic of this speech is cerebral palsy. The purpose is to inform the audience of how CP can affect a loved one. Cerebral palsy is an ailment that can affect people differently according to what type they may have. Let's take a look at a few. Do you have a loved one with cerebral palsy? Movements, and sometimes patients have ataxia as well. Mixed cerebral palsy happens when there is damage to the extrapyramidal and pyramidal parts of the brain. Spastic CP is very significant to me. This is the type that my daughter is affected by. While all types of CP is caused by damage done to the cerebrum or brain sensors, spastic CP is the most common type of them all, which this kind affects more than 80% of cases. This type of CP affects both the nerves and muscles. Spastic CP has a type called diplegia, which is when the CP is affected in the lower extremities of the body, usually in the legs, hips, and pelvis, and causes the muscles to contract constantly. During this process, the body is very tense and tight. palsyhelp.com is unsteady walk marked with uneven steps. They noted that some of some with ataxic CP can walk unaided but may use a walking aid or wheelchair. Apnea is a symptom of ataxic CP as well, which is a breathing pattern that is abnormal, but it is very rare that those affected with CP actually get it. There is also other symptoms that follow the patterns with a person of CP, and those include seizures, mental retardation, impaired speech, sight, or hearing. Symptoms of mixed CP include involuntary movements that often interfere with speaking, feeding, reaching. The treatments that are available for patients that are affected with CP. BrainandSpinalCord.com said that physical therapy is a gold standard of treatment for all types of CP. So whether it's spastic or mixed, physical therapy is a great treatment for the patient. Occupational speech can also be of assistance for the patient and can help the person into a better, more self-efficient lifestyle. While some others will continue to need assistance, it is still beneficial for them to get therapy. We have covered the symptoms, and now we're going to go right into the treatments for these types of CP. Mixed CP is treated by symptoms that present themselves, such as if spasticity is an issue, it may be treated with medication. Sometimes surgery may be discussed if the physician feels it is necessary and will bring the patient a better quality of life. Spastic diplegia and quadriplegic CP is treated with, as I stated earlier, physical therapy focusing on range of motion and stretching. Again and again, any medication a physician feels is necessary for any presenting issues. We have discussed three types of CP.